Air pollution is silently harming our health with devastating consequences. It's time to act against this growing threat.
Air pollution is a thing which is affecting all of us. I've been a Delhiite for a long time and I know how air pollution has increased over the years. First it was CNG, then it was BS6, but still air pollution remains major problem. And it's a significant and far-reaching threat to public health. With 99% of the world's population breathing healthy air, the risks associated with air pollution are similar to those caused by tobacco. So, exposure to air pollution can lead to cancer, stroke, respiratory, cardiovascular diseases, and other health issues. Air pollution is now estimated to cause nearly 7 million deaths a year worldwide, and this figure is comparable to the excess mortality caused by COVID 19 in the 2 years. And low and middle income countries like India account for 90% of the premature deaths, and it is threatening progress being made in reducing the cancer burden worldwide. So it is causing creating havoc, and we don't know exactly what that limit has not been reached because it keeps on increasing year by year. So it is caused by fine particulate matter, that is PM 2.5 or 2.5 micrometers in diameter or smaller, which is a mix of solid particles and liquid droplets that can penetrate deep into the lungs and even enter the bloodstream. This matter includes soil, dust, soot, and smoke. It comes from various sources such as coal fired plants, cars, agriculture, fires, wood burning stoves, unpaved roads, and construction sites. And it can cause changes in airway cells down deep inside that can trigger lung cancer. Studies have shown that these changes are visible in about half of patients with lung cancer who have never smoked. And even at the ESMO, that is the European Medical Oncology Conference, Professor Charles Swanton presented research that highlighted that particles that contribute to climatic change are impacting human health, one important cancer-causing mechanism in lung cells. So, the Lancet Commission on Pollution and Health established that all forms of pollution cause 43% of lung cancer deaths, and air pollution alone causes up to 29% of all lung cancer deaths. So, this is fast outpacing smoking as a means of causing death. And governments around the world have acknowledged the adverse effects of household and ambient air pollution on their populations, but work to reduce these risk factors has been very uneven. And we need to prioritize reduction of air pollution in urban areas, promote active transport like cycling and walking, making urban areas less vertical and more horizontal, and reducing vehicle emissions, transition to cleaner energy sources, address indoor pollution, especially solid fuels for cooking and heating, and establishing air quality monitoring systems. So basically, the air pollution is creating havoc, and it is worse than smoking, and we seem to be very okay with it. Year by year, our tolerance levels keep increasing to the pollution we can take in.
Air pollution impacts our daily lives, but small, mindful actions can help us protect our health and environment.
We need to monitor what exactly is happening, how much is the AQI, and people are installing air purifiers in their rooms so that particulate matter gets less. And then we should be wearing masks like N95 during COVID when we go outside. Basically, not smoke. So basically, you're already smoking, so don't add insult to injury by smoking, and reducing the sick cars or the carbon signature. So each family has many cars these days. Each person has a job, so everybody requires a car. So we need to work out transport measures which are environment friendly also, and door to door. So basically having a solid framework of door to metro or door to others, e-rickshaws or something like that. It could be made more portable, or they could charge a slight premium for those who are going through cars. So maybe they can charge a premium, and but a seamless transport service which is cost effective and which is effective in reducing the number of cars that come into the city, as well as regulation of construction and active afforestation, that is greenery. So inside the house, if you can have greenery, air purifiers, and limit your exposure to pollutants, especially at a time when the pollution levels are very high, that should go a long way.